And it's a thrill to be here today, and I want to first thank everyone for their efforts in making neglected tropical diseases a part of the Malaria Caucus. This is really a big day for us because, as the name entails, these have been long neglected. Not neglected by and large by the public health community, but by the broad political community around the world. So just a little background, the Global Network for Neglected Tropical Diseases is here in Washington. We are funded primarily by the Bill and Melinda Gates Foundation to advocate for and help address the resource needs to scale up NTD control. And what are the NTDs? The ones in particular that we'll be talking about today are the 7 most common, and they are the ones that by and large impact the 1.4 billion people that Ambassador just mentioned today. The thing that's the good news about these diseases is that there are medications that are very cheap or donated by the pharmaceutical industry. They can be delivered once a year to the field at 50 cents per person per year. And that's a great return on any investment. And again, when you look at the integration with malaria, you get an even higher return if you bring the programs together. And I also like to say that it's often the most successful public health program you've ever heard of, but never heard of. And that is, in 2007, 546 million treatments went out for lymphatic filariasis. It's one of these diseases that causes the limbs to swell. And what that really means is that we have distribution networks out there working and doing a great job. This is a disease that can be eliminated, much like malaria. And many countries are well on their way. China's eliminated this disease, Korea's eliminated the disease, Zanzibar, and there's a host of other countries on queue to eliminate LF. So how do we get 546 million treatments out to the field? What the Africans have pioneered primarily through the river blindness program, it's a program called APOC, is a network of community drug distributors. And this has largely been designed because there was insufficient resources to work through a traditional health systems approach. So the Africans themselves trained the community members how to distribute the drugs, monitor their impact, and make sure that it was having the intended effect both on the epidemiology of the disease and really looking at how communities organize around their own health. And so this network has expanded to now 500,000 community drug distributors in Africa alone. And a study that was done in 2007, it was finished in 2007, it was a multi-country study, over 2 million people, looked at how do traditional health systems work to get drugs to the field, including NTDs and malaria, versus this community network. And the results really were astounding. Through the community approach, they were able to reach all the rollback malaria targets. That means children were diagnosed with malaria and treated in meeting the 50% target. More people were sleeping under nets, that's pregnant women and children, twofold more than through the traditional health district mechanism. And all of this was done at no additional cost, so highly efficient. So we hit the targets for malaria, we hit the targets for the NTD drugs, and we did this at no additional cost. That's the good news, and already the Africans are mobilizing on this and putting in interventions like vitamin A, maternal child health initiatives. And so they're really showing us as a community here that we can work with US government resources very effectively by working together. What this meeting means to me really is a new paradigm, both for this administration and for Congress, to look at how we look at the investments across the board in the Global Health Initiative and work with each other to break some of those silos down so that those investments are used more efficiently. And more importantly, that they're having the impact in the field that we want them to have, saving lives, improving lives, and helping to improve the economic circumstances in some of the poorest countries of the world.